Welcome everyone. I'm Yoong Koon from University Malaya Medical Center. These sessions we are going to talk about Masters of General Surgery program, the summative assessment. As you may already know, Master of Surgery is formed by the conjoint board, and the conjoint board members are Ministry of Health, University of Malaya, University Kebangsaan Malaysia, University Sains Malaysia, International Islamic University, College of Surgeons, KPJ Healthcare University College. All university has their own assessments, whether it's formative or summative. Most of them are quite similar with small variation. Today we are going to talk about University of Malaya summative assessment. This is the program overview of our Master of Surgery program. For a master candidate to pass the Master of Surgeries, he has to go through 3 phases. Phase 1 is general surgery, phase 2 is subspecialty surgeries, and phase 3 is general surgery and some subspecialties. Only have gone through all these phases and passed all the criteria, then he'll acquire the Master of Surgery certificates. And throughout the program, there is formative assessment, which is actually a continuous assessment with a 3 to 6 monthly feedback. On the other hand, there's also summative assessment, namely Part 1 examinations, which they have to pass. Alternatively, they can pass MRCS Part 1 and 2, both of them. Then they can proceed on from Phase 1 to Phase 2. And Phase 2 to Phase 3, there's no summative assessment, and then to pass the Phase 3, there is a final exit exam or the Part 2 examinations. Each candidate will have 6 monthly assessments. On the formative assessment, we'll look at surgical logbook, endoscopy logbook, supervisor evaluations, case write-up, course and conference attended, thesis and others. There's another sessions which focus on the formative assessment. These sessions will focus on summative assessment. Part 1 examinations or MRCS examinations in the first phase, and then also exit exam Part 2 examinations. Now you may ask, why do you need to know all this? As a supervisor, in order for you to guide your supervisee to go through the whole program, you need to know what are the summative assessment and the hurdles that they need to clear. And if you know the structures of the summative assessment, you might want to tailor your training and supervisions in order for them to clear the hurdles. If you look at the Part 1 examinations, it's mainly divided into written examinations and clinical OSCE. On the written examination, there's paper 1 and paper 2. Paper 1 is basic science, consists of anatomy, physiology, microbiology and pathology. Paper 2 is principles of surgeries, consists of SVA and EMQ questions. So basically, if you want to prepare your candidate to prepare for Part 1 written paper, all these are basically theoretical knowledge that candidate have to prepare for. On the other hand, there's clinical OSCE. Clinical OSCE can be divided into applied knowledge and applied skills. And applied knowledge consists of anatomy, physiology, critical care, microbiology, and surgical pathology. Whereas on the applied skills, there are principles of surgeries that they need to know, some procedural skills and communication skills that they need to learn. And all these are in the syllabus of the Master of Surgery program. So if you know the structures of examinations before the patient go for the Part 1 examination, you might want to advise how they prepare the examination and how to get them ready. Now a bit more details about Part 1 examinations. The first attempt is usually 6 months after entering the program. Consider the usual intakes is in May or June, and the attempt will be in November usually. The exam is organized twice a year or when necessary. Candidates are required to achieve of 50% or more marks of the examination in order to pass. Alternatively, candidate can pass MRCS both Part 1 and 2 as an alternative pass to the Phase 1 of the Master program. Candidates who have passed MRCS Part 1 and 2 still required to sit for the Masters of Surgery Part 1 examination for the reason of benchmarking. Candidate can continue to general or subspecialty rotations when they are attempting to pass Part 1 examinations. Should they fail the Part 1 examination on the first attempt, they can continue their rotations. However, failure to pass Part 1 examination for more than 3 attempts will result in discontinuation of the program. In other words, they will be kicked out of the program. The maximum times allowed to complete the Master of Surgery program, bear in mind, is 7 years. Now let's go to Part 2 examination. Part 2 examination is basically the exit exam of the Master of Surgery program, and hence it's a high-stake examinations. It consists of 3 components. Component A, which is written paper with paper 1 and paper 2. Component B, which is viva voce, which consists of 5 stations: principle 1, principle 2, operative surgery, surgical pathology, and critical appraisal of research papers. And component C, which is a clinical examination, consists of modified long cases and short cases. Now let's look into the different components of Part 2 examinations. Written paper components. It has 2 papers. Each paper has 2 long questions and 5 short answers questions. Candidates have to achieve more than 50% of the written examination paper. Clinical wise, there is 2 long cases and 3 short cases. Similarly, candidate have to achieve more than 50% in order to pass the clinical component. Viva voce consists of 5 stations. They are principle 1, principle 2, operative surgery, surgical pathology, critical appraisals of research papers. Similarly, they have to achieve more than 50% to pass. For written paper, once the candidate passes, it is valid for 3 attempts of clinical or viva voce examinations. In other words, once the candidate passed the written paper, even if he failed the clinical or viva voce component this time, he can be excused from sitting the next examination's written paper and proceed straight away to clinical and viva voces. Cross compensation within each component is allowed. For example, paper 1 and paper 2 can be cross compensated as long as candidate has more than 50% in combined, then it is considered a pass. Similarly, long case and short cases can be cross compensated, and within the 5 stations of viva voce, it can be cross compensated. However, cross compensation between the components are not allowed. In other words, candidate has to pass each component in order to pass the examinations. Now let's look at the flow of the Part 2 examinations again. Candidate has to first sit for the written papers. If the candidate passed the written paper, then he is allowed to sit for the clinical long and short case and viva voces. If they pass both of the components, then they are considered pass the Part 2 examinations. Should the candidate fail the written papers, it is considered a straight fail. Should the candidate pass the written paper, when he's sitting for clinical long and short case and he failed the clinical long and short case, he will still be allowed to sit for the viva voces because he doesn't know the marks of the clinical long and short case, and proceed on with the examinations. However, he still failed the overall examinations. A bit more details of the Part 2 examinations. The first attempt is 4 years after entering program with all the requirements fulfilled, namely pass the Part 1 examination or MRCS exam, complete required clinical rotations, complete TC submissions, complete 3 case write-up, pass formative assessments. Exams are organized twice a year or when necessary. Candidate required to pass every component of the exam to pass. There's no limitations in the number of attempts in the Part 2 examinations. However, the maximum time allowed to complete Master of Surgery program is 7 years. Now, when the candidate has passed or failed the examinations, the conjoint board is the body to endorse the result. Even if the candidate has passed the examinations, the University Senate has to approve the results and to approve the completion of the Master of Surgery program and issue the certificate of completion. Now that is the short summary of the Master Examination Summative Assessment, namely the Part 1 and Part 2 examinations. Now that you know how they are run and each component of the assessment, I hope you can help the candidate as a supervisor in better preparation for their examinations. You can focus on different part of the examinations at different phase of their training. Thank you for your attention.